Right, welcome to our session today. We are very excited to welcome Western Michigan University School of Medicine. So I'm going to hand it over to Val to talk to you about their medical school.
Great, thank you. And are you able to see the slides?
Yep, we see you, we
Okay,
hear you.
perfect. Sounds good. So yeah, we'll go ahead and get started. Thank you everybody for being here today or for watching the recording, however you're joining us. My name is Val Horwath. I'm the manager of admissions at the Western Michigan University Homer Stryker MD School of Medicine. Super excited to chat with you a little bit about WMed is what we call ourselves for short. We do have a little bit of a long name there. And some of the things that make us unique, our admission process, all of that. Recognizing absolutely that across medical education and medical school admissions, there is a lot of standardization in the process, as there should be, right? For good reason. We want our future doctors held to those standards. So there can be a lot that is in common. And I'll try to point out as we go along some of those things that you can expect to see at other schools and other parts of the process, and some of those things that are unique to WMed. And obviously plenty of time for questions at the end as well. So with that, we'll go ahead and jump right in. If you are not familiar with Western Michigan or with WMed, we are in Southwest Michigan in a town called Kalamazoo, which does exist as different as the name might be. And Kalamazoo, I think, obviously I'm biased, but I think is a really great place to study medicine. So we sort of have the best of both worlds where we are not a medical school in a completely urban, large city environment. We're not in a completely rural, small town environment either. We're sort of right in the middle. The greater Kalamazoo area has over 250,000 residents. I would say it's a pretty typical mid-sized Midwest community. And our students get access to a wide variety of patient types, clinical settings, all of that within a really small radius of our campus. So our city of Kalamazoo itself, the city of Kalamazoo proper, our medical school is right in downtown Kalamazoo. We have a great little downtown area, and the demographics definitely mirror a larger urban environment. We have a wide variety of race and ethnicities, socioeconomic statuses, religious groups, different things like that. Then if you go about 15 or 20 minutes outside of downtown Kalamazoo, you get quickly into some really suburban feeling environments. If you go another 15, 20 minutes outside of that, you get into some really rural environments. So all of this is within Kalamazoo County, and all of these are clinics and things like that around Kalamazoo County are run by our two partner institutions, Borgess and Bronson, which are our two hospitals that we have in Kalamazoo that are formal partners with the medical school. So within pretty much a 30-minute radius of campus, which is where we guarantee all of our students their placements unless they elect to do something further away, our students really get exposure to a wide variety of patient types, patient health concerns, clinical settings, different clinical resource levels. Even Borgess is a religiously affiliated, pretty strongly religiously affiliated hospital. Bronson is not. And so they also use different patient data systems and all of that. So our students really are well prepared for any different type of environment that they might go into in the future. We are a private medical school. The Western Michigan University is a public university, if you're familiar with them at all, but the medical school is private. And so this means that unlike state medical schools, we do not have any in-state quotas for student attendance. And so we are very out-of-state friendly. Michigan is still our largest represented state, but it's typically only about 40% of our class each year. So 60% or more than half of our students come from outside the state of Michigan each year. So, assuming most of you don't have Michigan residency, which is totally okay, we are very out-of-state friendly. We are also a newer medical school. So we welcomed our first MD cohort in 2014. We are just about to graduate our 7th cohort of MD students next month, if I'm doing that math correctly. And so with being a new medical school, there are definitely some advantages. We are more adaptable to change and things like that. We like to say that we are keeping the best parts of medical education and moving forward with those. But there are also some things that we do differently that we think are maybe better ways to learn medicine. And we don't have, hundreds of years of this is the way we've always done things. And so being, unable to change or things like that. Now, with being a new medical school, sometimes people have hesitancy about, preparation, reputation, all of that. We are fully accredited. We have also been fully re-accredited for the first time, so no worries there. But there's also a very strong legacy of medical education, both with WMed and in our Southwest Michigan community. If you were to come to visit with us or to apply to us, you might interact with a faculty member or a physician who says, oh yeah, I've been with WMed for 25 years. And you're like, the math does not add up on that. How is that possible? So we actually have had residency and fellowship programs at WMed for the last 30 years. We sort of got our start backwards as opposed to how most medical education programs do. So those have been well established, and our two partner hospitals have also been hosting medical students and residents for the last over 100 years. So with that, we already had some of that name recognition. We weren't, a truly unknown entity that a brand new medical school would be. And because of that, we have matched above the national average every single year since we have existed for the MD program. This is last year's match data. We don't yet have the shiny new graphic for this year's match rate, but as you can see, we match all across the country. Last year, we were almost 50-50 split primaries versus specialties. This aspect truly varies each year just based on student interest. So the year prior, it was more of a 40-60 split. Last year was almost 50-50. This year, I don't know the percentages, but we definitely had more students who matched into and were interested in specialties again this year. So all that to say is we can kind of prepare you for any area that you want to go into. We've also matched at this point into every specialty that exists as well. So no worries there. One really big thing to know about WMed is that our overarching vision, mission, values is health equity. And so with that comes a lot of community engagement. We are very invested in the health equity of Southwest Michigan and helping to improve the health outcomes in our local area, and then equipping our students to become physicians who continue that work and that mission in any community that they land in. So this shows up in a lot of different ways. We'll talk about how it's kind of built into our curriculum in just a minute, but our students do a lot of work with the local community, as well as our faculty and staff. Some examples of what this looks like are, we have a street medicine team that was actually student and resident founded that goes around and works with our local unhoused population in Kalamazoo. They actually just got a van this year so they can kind of carry more supplies with them and operate a little bit as a mobile clinic, offering education and some basic medical resources and services to that population. We also work with an organization called Cradle Kalamazoo. They address maternal and fetal mortality rates and disparities in our local Black community. Our gardening interest group grows food on campus right outside our doors and donates it to a local food pantry. So just some quick examples of a lot of different ways that we are involved in the greater Kalamazoo area. There's also a lot to get involved in on campus at WMed as well. We have over 100 student organizations on campus, which is kind of a very large number considering how small and new of a medical school that we are, but those are all student created. Some of them, as you might expect, are student chapters of national medical organizations, national professional organizations. Some of them are specialty specific. So for example, we have our surgery interest group. They will book out additional time in our simulation center for students who are interested in practicing additional cutting and suturing and really refining those skills. We have some that are different affinity groups and some that are purely interest-based. So like I mentioned, we have a gardening student interest group, volleyball, gaming, lots of different options. And if there is something that you feel like we're missing, you can start your own with just 2 other friends. One thing that we do that is pretty unique is we follow a team-based learning model. So it's called TBL, team-based learning. And basically what that means is that about 90% of the formal activity that our students do is in some sort of group or team setting. This is not, though, your traditional college group project that everybody hates. We know those are no fun. But the concept is that medicine is a team profession. Physicians do not work in isolation. They're constantly interacting with other physicians, nurses, hospital staff, patients, and families. So we want you to be learning medicine in as similar of an environment to that as possible. We also are very hands-on. And so some medical schools follow a more traditional model of mostly classroom learning the first couple of years or the first year, and then more hands-on learning toward the end. We actually get students into our simulation center during their very first course block on campus. So we do hands-on learning hand in hand with sort of text-based or lecture-based learning so that you're immediately applying everything that you're learning in lecture, learning in the classroom into some of those hands-on medical skills. During that first course block, our students actually go through Michigan Medical First Responder certification and all become certified medical first responders in Michigan. And so that is a 2-week long training process, very hands-on in our simulation center, learning some of those immediate medical skills. And then they ultimately put everything to the test out at a local firefighter training center in a simulated mass casualty event. But then they're able to use those skills out in the community if they so choose. Our students will sometimes work Western Michigan football games or the Kalamazoo Marathon, or be able to volunteer as a first responder in an in-flight medical emergency, wherever those skills can be useful in their life. But then they also have them to draw on and to be relevant as they're learning throughout the curriculum as well. Speaking of curriculum, we run our curriculum a little bit differently from a traditional medical school model, and certainly from most traditional undergraduate models. So we run a decompressed curriculum. We are still a systems-based curriculum though. So 1 course per body system, but instead of a traditional term or semester model where you might have 3 to 5 courses over a traditional 15-week semester with longer breaks in between, we focus on 1 course at a time for 4 to 6 weeks. 5 is average, followed by a 1-week break after each. So I apologize, you're not going to be able to read the very tiny words on the slide, but just purely for visual illustration purposes, we have our curriculum maps to look at here to sort of help illustrate what the decompressed curriculum looks like. And every, again, don't worry about trying to read the course names, but every brown block is a biomedical sciences course. Every green block is a break week. So we follow a 1 course, 1-week break, 1 course, 1-week break rotation, a little bit longer breaks around the holidays. And so because of that, we finish up the foundations or the preclinical curriculum in about 18 months. And so we do go year round that summer between years 1 and years 2, but we have the same amount of break time just dispersed throughout the year. The purpose for this is twofold. So the first is knowledge retention, right? Instead of cramming for a bunch of exams at the end of a semester and then promptly forgetting about half of that information over a long break, we are able to chunk it up into smaller bits and kind of build on itself throughout the curriculum. The other is wellness, which is a really big focus at WMed for students, faculty, and staff. And so medical school is going to be hard and challenging no matter where you go, right? We want it to be to some extent, but we also want to proactively build in a structural way some of that burnout prevention, and having that break after every course allows our students to really decompress and come back refreshed and ready to learn for the start of the next course. Those break weeks, which we call green weeks for quite no other reason than they're green on the curriculum calendar, but the name has stuck. But during the green weeks, students are able to do research if they're interested and participate in that longitudinally, do community engagement, travel with friends, go home and visit family, lay on the couch and catch up on Netflix, like whatever is going to be restful and restorative. And that looks different for every single student during every single break week. Because we finished that up in 18 months, and in that arrangement, our students actually have a little bit earlier dedicated period to study for step 1, and then starting those core clerkships about halfway through second year. So again, really focusing on getting early access to those clinical rotations and some of those hands-on skills. What I also didn't mention are we have these gold longitudinal courses which run throughout the curriculum. So those are things like focusing on clinical skills and professionalism in medicine, engagement and discovery, that is kind of the incorporation of community engagement. And then disease disparities and justice is our incorporation of health equity into all of the different courses. And then from there, we have those finishing up those core clerkships in year 3. And again, a little earlier dedicated period to study for and take step 2. Kind of making sure you finish all of those clinical skills before you are taking step 2, now that that is the main score focus for residency applications. And then 4th year, you'll see there's a lot of green, but that is not unengaged time. So 4th year, I like to call choose your own adventure year. There are definitely advanced clinical rotations, advanced electives and specialty areas. We have some study abroad opportunities as part of our global health distinction. Obviously, highly supported through the application and interview process for residency, away rotation opportunities, if I didn't mention that. So everybody's 4th year, it can be really, really highly personalized toward their interests and their area of medicine. As a newer medical school, as you could expect, our facilities are pretty nice. That's definitely one of the benefits of being a newer school. Our building was fully renovated when the medical school opened. We do have a virtual tour on our website. There is a quick QR code if you would like to take a screenshot of the slide or take a picture of that to check out later. But that virtual tour is kind of nice. It allows you to walk through our building and see some of our different spaces through photo and video. Our crowning jewel of our building is definitely our simulation center. When we opened, it was the largest at any medical school in the nation. Now I'm told it's the 4th largest. So a few schools have done some additions or something like that, but it's still the largest in Michigan, and it is truly state of the art. Stryker, having their headquarters in Kalamazoo, and the relationship with the medical school, supplies our simulation center with all current, all cutting edge medical equipment. It is not where the local hospital, donates their old stuff they're getting rid of to the local medical school at all. It is everything that you will see out in the real environment. On the hospital side, we have our high fidelity mannequins, which I say is the closest you can get to being human without having sentience. They can talk, breathe, blink, they have a pulse, they can move. They can respond to external stimuli, they can excrete fluids, they can intake fluids or medication. We have ones you can operate on, ones that give birth, all of that. And so it is very, very realistic. We have a couple standard patient rooms, an ICU, a trauma bay, pediatrics, labor and delivery, operating room, scrub station, all that good stuff. And then on the clinical side, we have our standard patient exam rooms, which look like your typical outpatient clinic or doctor's office. And that's where we have our standardized patients, which are kind of paid actors that they are hired by WMed. They learn a script about their history and their ailments and their symptoms. And then our students get to go in and practice reading the patient, taking the patient history, listening skills, asking the right questions, conducting those physical exams, etc. The other thing that's pretty unique about our medical school is that we are home to the Kalamazoo County Medical Examiner's Office. And they are in our building. They serve Kalamazoo and 9 surrounding counties, including one in northern Indiana, which is the largest area served by a medical examiner's office in Michigan. So if you want to talk about real world examples in real life learning. Our students do get to see the good, the bad, and the ugly that comes through the medical examiner's office. And it is a really, really unique opportunity to be able to immediately see a wide variety of real life applications of what they're learning about in class or even in anatomy lab, and to see many, many iterations of that in a real life example. Lastly, I want to talk about our size and our mentorship. So our class size is 84 to 86 students per year. We are the smallest MD program in Michigan, and certainly small for an MD program in general. It is not unusual to see MD programs anywhere from over 100 to 300 students per class, but our size is intentional. We are not trying to grow that number. That is sort of our sweet spot. And so if you're looking for really a small school, kind of highly individualized environment, then we could be a really good option. Our faculty know all of our students by first name. They have an open door, open office policy. And so students really connect with faculty and can get a lot of outside of class learning and mentorship as well. We have, like most medical schools, big little siblings, so peer mentorship between our classes. We have staff and academic advisors that serve all of our students, and career advisors that serve all of our students, as well as faculty advisors for each learning community, which we have 4 of in our building. So to kind of give it even a smaller school feel, we have 4 learning communities that kind of further split up across our 4 classes. And then those learning communities are how we group students for things like anatomy lab, simulation center, etc. One thing that we have that is pretty unique is we also have a community physician mentorship program. So our students are able to be paired with a local physician who, and if you have a specialty area in mind, we can kind of match that up as well. And that is a really valuable resource for our students to get some of those, insider tips and tricks. What is it really like in the profession? Additional networking opportunities, and so our students really do value those relationships. We also have 2 dual degree options. We have an MD MBA and an MD PhD, both available through Western Michigan. These are not anything you need to have decided upon in advance. Students actually have, I believe, up until the end of their first academic year to decide if they want to pursue one of the dual degrees. So there's not a separate application process or anything like that, like some schools might have. But if you know that you're interested, once you get to the interview stage with us, you would just let us know and we can get you connected to additional admission information. Now, the other program that I do want to spend just a minute talking about is our Bridge to MD program, which is our Master of Biomedical Sciences. Quite a few medical schools have Bridge Master's programs, which are all typically about a year program that you would do before starting medical school after completing your bachelor's degree. And we run ours a little bit differently than most. So the first big difference is that it is essentially a free master's degree. We offer a full tuition scholarship to every student in the program, and many students receive a cost of living stipend as well. The other big difference is that our students are guaranteed a spot in the MD program the following year, obviously, as long as they successfully pass and graduate from the master's program, all kind of in time and things like that. It is still that traditional 1-year program. Just like our MD program, it is a small cohort as well. So Bridge Master's programs can typically be pretty big academic programs, but ours is very small. We accept up to 10 students per year because we want it to really be that highly, highly supported extended transition to medical school for students that might need or want that. There are 6 courses. It is a course-based program, and they are taught by medical school faculty. The students are full, WMed students with full access to all of our facilities. And 3 of those 6 courses actually run alongside the current MD students. There's also a literature-based thesis in that year as well. There are 2 different ways to apply. So the first way is just to apply to WMed through the MD program. If you are not admitted, you're able to use that AMCAS application that you spent all that time and energy on to be considered for the MBS program without having to do any additional application effort. We also, for the second year this year, have opened direct applications to the masters as well. Those are currently open through May 15th. So if any of you are graduating or in the post-bac and still looking for a program to do next year, you can still apply to the MBS program. But this is our second year of having that direct application route as well. We are able to give a little bit of application priority to students who have a strong connection to Southwest Michigan, but that's not required, or are first generation college students or low SES or have overcome significant life adversity. So that is not an and list, it's an or list. If you meet any one of those criteria, we're able to give your application a little bit of priority to the MBS program. Okay, I'm going to pause here for a minute and just see if anybody has any questions so far about anything that I've talked about WMed before we get into the MD application process. Hearing none immediately, we will continue on. But if any questions do come up, don't hesitate to let me know. So everything from here on out is going to apply to our traditional MD application process. Like many medical schools are starting to do, if they haven't already, WMed uses holistic review and has since we have gotten started. We do follow the EAM model from the AAMC. So we are considering your experiences, attributes, and metrics as part of our process. What those mean for us are that your metrics include your GPA, MCAT, and trend of grades. For GPA, there are 3 different ways that we look at GPA. We look at obviously your cumulative GPA as well as your science GPA. And then any post-bac classes that you have taken, we will look at as well. If you take up to 29 post-bac credits, we sort of roll that in and give you kind of like a hybrid cumulative GPA. If you hit 30 or more post-bac credits, then we are actually able to use the post-bac GPA to replace your undergrad GPA, which for most students that typically advantages them. So a few different ways we can look at GPA. We also will look at trend of grades if needed. We definitely understand transition to college, transition to those upper division hard science classes can be challenging. So if you have a bad grade or have a bad semester, it is not the end of the world. What we want to see is that you're able to utilize some strategies, show improvement in those. What we don't want to see is sort of getting to that senior slump or really struggling in those hard science courses and not able to, utilize strategies or kind of recover from that, because that would then make us maybe question if you're fully ready for the rigors of a medical school curriculum. For the MCAT, our minimum for the MD program is a 499, minimum 497 for the MBS program. For MCAT, if you have multiple attempts, we will always look at the most recent or the latest MCAT attempt. We do not super score or anything like that with multiple attempts. We will just look at the total score of your most recent attempt, which again, for most applicants is going to be their highest score. Now, experiences is where we typically get a lot of questions. So obviously we want to see those pre-medical experiences. Always we want to see shadowing in some different environments. You can think of shadowing as kind of your medical experience prerequisite that we want to see everybody have who is applying to medical school. Again, preferably if you have the opportunity, shadowing, maybe a couple different specialties or a couple different environments, hospital versus, doctor's office or things like that are good. Really what the purpose of that is to get you exposure to medicine as the profession, as opposed to your experiences as a patient or family member in the medical world. But we also want to see all of your non-medical experiences as well. We also, though, with medical experiences, I forgot to mention, anything that you have the opportunity to do that goes beyond shadowing or volunteering in a medical setting is always going to be encouraged by us and probably most medical schools. So again, it's not required to have paid or patient contact experiences because we know that's not available to everybody. But if you have those opportunities, we will always encourage you to take advantage of them. So some really good opportunities for patient and physician contact can be things like medical assistant, CNA, EMT, medical scribing, different things like that. But for your non-medical experiences, this can really be almost anything. So certainly things like community service, work with underserved populations, research, student organizations, honors and awards, study abroad or religious groups, part-time or full-time employment, really anything that you are passionate about or that you are dedicating your time to are things that you can list on your application. Also, feel free to list any significant life experience that you have had or anything that's impacted your journey. We have students who have had to work full time to support a family or support themselves through school, or we have students who might have children of their own or might have to care for a sick or elderly family member or have a major illness or major life event happen that impacts their studies or their journey. So I always say you're bringing your whole self to medical school. So we want to get to know your whole self as part of our admission process. So don't feel like you can't share those different experiences if it's been impactful to your journey. Your attributes are what makes you the unique individual that you are and the unique position that you're going to be. So this is your personal characteristics, values, and morals. And as you could probably expect, this is the least straightforward aspect of the admission process. It is a lot harder to gauge and judge than a test score or number of hours at an experience. And so this is where we tend to spend the most time in our application and admission process. So we get at attributes in a variety of ways. We use an online assessment as part of our secondary application. It is not Casper, it is not Preview. If you have heard of those assessments going around, it is totally free. First of all, it is homegrown by WMed, created by our admission committee, just for the different things that they're wanting to look at. So it is something that is supposed to be quick and easy. It is not supposed to be challenging or gatekeeping or anything like that. Unfortunately, it's not really something you can study for or prepare for, though, but really it is just kind of designed to get to know our applicants better. Similar with our telephone interview. We are one of the only medical schools that uses a phone interview as part of our application process. And this tends to trip people up the most only because it is unusual and it's not part of the traditional application process that you are preparing for at all of the other schools that you're applying to. But again, it is not designed to be a part of the process that causes anxiety or trips students up or anything like that. It is about a 15 or 20-minute phone interview with our phone interviewers who do not have access to your application or anything. So they're just asking you some questions to get to know you and see how you might respond to different situations or things like that. And then we have our virtual interview. This is how our campus interviews are going to be proceeding, at least for the next few cycles. It is just easier for everybody to participate virtually. You don't have to pay or take time off work to fly to Michigan to interview and things like that. So we have plenty of opportunities to visit in person if you would like to, but our virtual interviews are definitely going to stay around at least for the next few cycles. Some important information about our application process is that we are only able to accept applications from US citizens or permanent residents, unfortunately. Our minimum GPA, I don't think I mentioned, is a 3.0 for both the MBS and the MD. For the MD, we did talk about 499 MCAT, 497 for the MBS program. Obviously, we utilize AMCAS for the MD applications, and our primary deadline is not until November 15th. However, we do use rolling review, rolling admission at each stage of our process. And so we encourage you to apply early if you're able to. When we say apply early, typically that means like midsummer, mid-July is when we recommend. Obviously, AMCAS applications open in May each year. Schools don't actually start receiving that data though until end of June, beginning of July. So you have plenty of time. You don't have to, pull an all-nighter the night that it opens or get everything submitted that very first week. But again, thinking of kind of midsummer is what we encourage students to aim for, especially knowing that we have a few additional steps in our process, like that phone interview, and we definitely want to make sure that you have enough time to be considered and to be moving through our process at a similar stage as what you might be doing for other schools. The caveat to that, right, is that we don't want you to apply early if it means sacrificing the quality of your application. So we want you to apply when you have your best and strongest application. Once you have that, don't sit on it, but don't apply early if it means sacrificing that quality. Definitely want to make sure that we kind of have that. With that application though, we do ask for 3 to 4 letters of recommendation. We prefer 2 of those be from a science faculty member or a physician. The other 1 to 2 are student choice, definitely quality over quantity. They can certainly be from another physician or science faculty member, but they don't have to be. If you have somebody like an advisor or a coach or a mentor or a supervisor who can speak really deeply to your qualities, and we would definitely prefer that over an additional faculty member who maybe you only had for 1 semester and they didn't know you as well, things like that. So again, use your own judgment, consult with your advisors and mentors on that and be thinking about those letters. But for us, yeah, we have just those little caveats. We actually don't transcript check for required prerequisites anymore. So we have some recommended courses for students that are interested, but we know that if you are part of the pre-med program here at all, that we trust that you're taking, that healthy course load in those hard science classes, as well as a well-rounded curriculum. So we know that in order to do well enough on the MCAT, you're going to be covering those. If you do have specific transcript questions, you're always welcome to reach out to us. But we also don't have any requirements on, or I should say, we accept community college credit as well for your public credit. We online courses, AP, we kind of don't have any restrictions on the modalities or formats of those prerequisite courses. So here's how everything fits together in the application process. We'll start with that primary application submitted through AMCAS. As long as you meet our minimum GPA and MCAT and obviously don't have any like institutional actions or felony charges or anything like that, then we automatically invite you to complete that secondary. So our secondary application is not a cut stage of the process. As long as you submit that primary and meet our minimums, you're guaranteed that secondary app. So because of that, our supplemental essays are continually posted on our website. You can view those at any time. And certainly if you're applying and you meet those minimums, you can be working on those ahead of time. So that secondary application includes those supplemental essays, as well as that online assessment that we talked about. From there, we conduct our review of your application and we call it our experiences review. Our application readers conduct a blind review. So they do not see your name, your institution, any identifying or demographic information. They are just reviewing the quality of your application, essays, and experiences. From there, we do that phone interview that we talked about. The phone interview is conducted by a separate group of individuals. And so instead of having just one person kind of go through your entire application file and give their opinion of your application, your preparedness for medical school, we want as many eyes as possible on that throughout the process, right? So that we have as balanced of a review of your application as possible. Then from there, we have that virtual interview. Our virtual interview includes a traditional one-on-one open file interview with a member of our faculty or member of our admission committee. It also includes a group interview activity. So this really gets, again, at that team-based learning focus that we have. So we have small groups of 4 or 5 other applicants, and it's kind of like a creative problem solving, group discussion type activity. Again, nothing, it's pretty lighthearted. It's nothing that you can study for or prepare for, anything like that. We just want to see how you interact with other students who could one day be your medical school classmates. And then from there, students receive their admission decision. Now, this is our class profile for our current M1s, our previous cycle. Just helps so that you can see how students move through our admission process. So last cycle, we received over 4,100 applications to get down to our class size of 84. This cycle, we received over 4,300 and our class size will be 86. So we did this year increase the number of phone and virtual interviews that we did to accommodate that increase in applications. But again, still getting down to relatively the same class size. So definitely medical school application process is competitive no matter where you're choosing to apply. Feel free to take a look at the information on the slide. I'm not going to go over every single data point, but I do always like to talk about some of our averages. So our average age last year was 24 and a half, almost 25, with a range of 21 to 39. So I highlight this to reiterate what I said earlier. We want you to apply to medical school when you are most ready for medical school, right? So for some students, 21, that is kind of right through from undergrad, very traditional, in quotes, pathway. For our average student, and this is also on trend with the national trends or national averages that we're seeing right now, but the average student is taking a gap year or two, whether that is to do a post-bac program or research or employment in the medical industry, things like that. This is not surprising to us at all. We've kind of seen this for the last couple of years, particularly as we still have cohorts of students coming through who had some like fully remote semesters because of the pandemic, or hospitals weren't letting students in for shadowing and they couldn't get all their experiences, things like that. So I'm kind of personally curious to see where that goes in the next couple of years, if we're going to see this kind of continue as a new trend or a new normal, or if we'll see that that average age decrease a little bit. We'll see. But then obviously all the way up to 39, every year we have some non-traditional applicants and some non-traditional students admitted to the class who might have had just simply a non-traditional education pathway, or be career changers, or have taken time off to raise a family, or whatever the situation might be. So again, I reiterate that just to say we want you to apply to medical school whenever you are most ready, and we don't look negatively or differently on gap year, no gap year, or any different life circumstances or pathways. Our other averages are metrics: GPA 375, MCAT was 513 last cycle, with a range below that of 500 to 524. When you are looking at different profiles on MSAR, different schools you're interested in, never count yourself out of a school if you don't exactly meet their average metrics above or below, just because keeping in mind those are averages. And typically, especially with a school that uses holistic admissions like we do, those actual ranges can be pretty wide, since we're looking at so much in addition to just your metrics. I always tell people your metrics get you in the door, right? They guarantee you that secondary application. And we're always going to be looking at it and considering it, right? We're never turning a blind eye to your metrics, but the further you get in our process, the more we learn about you and your attributes and your experiences, the smaller part of the equation that the metrics are going to become. So they're always in consideration, but it is not the primary thing that we are looking at. And then finally, the last one that I'll highlight is research experience. So we are typically at about 90% every year. That holds pretty steady. A lot of people see that and think that it means that we require research. We actually do not. We know it's a very common part of the pre-med experience. And so if you have research experience, we will absolutely consider that in part of the application process. If you don't, that is also totally okay. It is not going to hinder your chances at all. Similarly, for our current students, we have a wide variety of research options available. We do have traditional, wet lab bench research opportunities. More of our research, though, focuses on public and community health, clinical research, and medical education research. But students are not required to participate in research if they don't want to. Many of our students do. We actually have typically over 50% of our students actually published before they graduate, which is pretty cool. So our students are definitely still able to fit in research and actually get involved a little bit more deeply longitudinally throughout those break weeks with that decompressed curriculum, which is pretty cool. Lastly, I want to give you all our admissions email. We did just go through a domain change last year. So if you have, heard from us at all or looked at anything prior to this year, our domain name is different. So the old one won't work anymore, but admissions@wmed.edu, feel free to write that down or take a screenshot of the slide. We truly welcome outreach at any point in the cycle. Sometimes students think that, oh, if I email too many times with questions, they're gonna, think negatively or they're going to take notes of that. We are not taking notes of that at all. We are always happy to answer any questions that we are able to, whether it's next week and you just thought of something after this session, or if it's months or years from now when you're in cycle with us. Don't ever hesitate to reach out if there's anything that you're wondering about, or if you have any individual questions that you don't want to ask in front of the group, we can always find a time to chat offline as well. But with that, I think that's everything that I wanted to be sure to share with you all today. So we can go ahead and open it up to general questions.